Right now I'm talking to Meredith, who's going to tell me how I can reboot my body, or even better, I need a reboot of my life. Meredith, what's going on here at Bowen College?
Hi, I'm working with a client here who is going to receive Bowen, and we're going to just work on large muscles in a very, very strict protocol set out by Thomas Bowen, originally from Australia, and it's going to set our body into a deep, relaxed state, which is called a parasympathetic healing state, or an alpha brainwave state, something similar to when we might work in deep meditation or yoga practice.
So this type, is this a massage, or what do you call this?
It's actually called Bowen therapy. It's often thought of as massage, but it's not. What makes or sets Bowen therapy apart from other modalities is it draws elements of other practice in. Chinese medicine, quite a bit of elements of Chinese medicine, very valuable elements, Ayurvedic elements, myofascial release, lymphatic drainage, circulatory pathways, neurological pathways, lymphatic drainage, and we're working with the whole body on a global scale. So when we do the protocols, and there are well over 90 moves in Bowen therapy. 90.
Oh, 19?
We always begin with what's called the basic set out movements to relax the body, to set it in that parasympathetic state and get it ready, in a state of readiness to accept other movements.
Okay, so this practice is good for what in particular, or in general?
Oh, general health and wellness, but more specifically, it's very valuable for everything from chronic pain, old injuries, layers and layers of trauma, whether it's physical, even the emotional is very intrinsically linked. Releasing layers very gently. The key to Bowen is very, very gentle, very non-invasive. Often people fall asleep on the table. And in addition to releasing those tensional patterns and postural realignment, very gently shifting that to balance the body. So we're accessing different energy systems or respiratory, if someone has a history of asthma or chronic obstructive pulmonary disease, very severe respiratory issues, or digestive complaints. It can really, really support all of those systems, endocrine, hormonal, hepatic, the liver, kidneys, everything. So whether it's that kind of issue, or we have a shoulder injury from sports, or a hip situation, the hips are out of balance, Bowen can address all of that in a very comfortable, gentle, non-invasive way.
Well, it's like the whole shebang, right?
Yeah, absolutely.
Well, my friend Bob here at the show told me to come talk to you because apparently he's heard of so many raving reviews, like 90% cure rate, and, where if you go somewhere and you can't fix it, they come here and you fix it. And that's what drew me to the booth here. He gave me a recommendation from him. So.
Yeah, we really recommend, recommend trying a series of sessions as you would if you tried, say, a series of acupuncture. 3 to 5, 4 to 8 sessions. Really see where Bowen can take you. And it's just a wonderful unwinding experience. So what we Bowen practitioners or therapists really strive to do is encourage our clients and patients to really start driving their own healing process, become involved, become more sensing, and then we can start going in a really positive forward direction.
Okay, so what you do is you put them in a state of rest, into alpha, he's just saying, so they fall asleep very quick. So then you work on those pain releases, right? No wonder they don't feel the pain. They're asleep.
It's painless.
Painless. Yeah, there we go.
Yeah. So
okay. So walk me through some of the. How would you start? So what part of the body do you use, and what are you doing?
What we're doing is actually just what's called or described as taking skin slack. If you enter into a Bowen course as to be a potential Bowen practitioner, you'll hear the words skin slack. And all of the movements that are coordinated have a reason d'etre, or a reason to be. So we use skin slack, and then we'll challenge the muscle. We're asking the muscle, and we're actually cross-fibering, we're stretching it very gently, and we're just gently speaking to the body and waiting for it to respond back to us. Okay, so we're challenging the muscle.
So how are we doing this here? Can you demonstrate that?
I take skin slack, and I'm challenging at the edge of the muscle, and waiting for it to respond, to speak back to me very gently. And as soon as it does that, and that's maybe just a give or a notation of, oh, okay, then we will release it. So we're strumming the muscle like a string on a violin or a guitar. Very, very gently, we're sending a message to the brain. So we'll do that on the other side of the body as well. Okay, so we take the skin slack and we're finding the edge of the muscle and challenging it or gently stretching it and waiting for it to speak back to us.
So you get some kind of feedback and then you release it.
Yes. So that's the basis of a Bowen movement, and they're set out in a very, very strict protocol. There's a reason for all of the moves, and certainly in the basic moves. And it's important that we do the basic moves in every session, either the whole series or part. And the more Bowen we have, the less Bowen we may need. And also the key is the mantra of Bowen therapy is less is more. So we have pauses in between these series of moves. I might do 2 moves here and then wait. And we're waiting for a message to go to the brain and then the brain to assess what's going on in the body. And then we'll move up or down accordingly. And we'll do the same movement, skin slack, challenge the muscle, wait for it to speak to us, and then release. Okay? And same thing on this side. Okay, I'm just challenging the muscle, waiting for it to speak, and then releasing it. It's very comforting for the person to feel that. And often during the wait or the pause between these series of sessions, somebody might get a really nice response of warmth, a wash or a wave of warmth, some nice tingling. That's the body opening up. The circulatory flow, the neurological feed, everything's just opening up, readying.
So how long is a complete session?
45 minutes to an hour. It's really not recommended that one goes over an hour. Again, the mantra is less is more. Okay? So the nice thing about Bowen as we go on, we need less Bowen. So, you don't keep coming back year after year after year every week. You start to drive your own healing process again, and you might go for a series of 4-day sessions every week and then back it off, for a tune-up 3 months, 6 months. So again, depending upon our degree of injury, our degree of trauma that's been in our body, and how our bodies are gently releasing it. So
yeah, your name.
We're a team.
Yeah, your name Bowen, I would say, instead of your tagline being Reboot Your World, to say Bowen College. How's it going?
Great.
Because you want to keep your life going, moving forward, and no blockages, right?
Yes, absolutely. Get better, and even a lot of actually most of our practitioners have been through lots of trauma in their lives, tried multiple modalities. And the nice thing about Bowen is it draws several modalities together. You're getting so many different aspects on a global point of view. So the people that have tried Bowen and actually got a resolution on their way, and they become practitioners. So if you go around and ask practitioners, you'll find that's the same story.
Okay, just quickly, how long does it take to get trained to be a Bowen practitioner?
Fairly quickly.
6 months, a year, what?
It depends on when the modules are being offered.
Roughly. I have no idea.
I'd say a year to 2 years.
Okay, that's good enough.
But it's the art of Bowen. It's the art of developing the touch, soft, gentle touch.
Great.
It's not deep and invasive, and that's very, very important.
Great. Okay. Thank you so much.
Thank you.
Your website is?
BowenCollege.com. And yeah, it's very worthwhile.
Okay. Thank you so much.